Hello and welcome everybody to another of our BVNA COVID-19 webinars. The attendees, I can see the numbers are slowly increasing, so welcome everybody. We will leave it a few seconds before we start because it takes a while for everyone to get into the webinar. So I can see the attendee numbers are shooting up, so that's great. Welcome everybody. There are still some seats at the front. Don't leave the front row empty. Awesome. Okay, so welcome everybody. My name is Wendy Nevins. I am currently Senior Vice President of BVNA. The webinar this evening is being presented by Nikki Ackley. Nikki is from the BMAS, our BVNA advisory service. Her email is on the screen now. So just to give you some tips on how to make the most out of your webinar this evening, there is a chat box. If you have any questions, please do type them in there. If you have any questions for Nikki, we will try and hold those until the end of the session rather than interrupt her. So do type those in to the chat box. If you have any technical problems, again, please just use the chat box and we'll try and help you as best we can. If you're having audio problems, sometimes this can be caused if you're connected on Wi-Fi. So if you're connected via a tablet or a smartphone, then sometimes you can get audio disturbances. The best thing to do in that case, if you can't connect to a wide internet, is to dial in on the telephone. So in your control panel, on the black toolbar by the microphone symbol, there's a little up arrow. If you click that, and you can dial in on the phone. There's a phone number, a webinar ID and a participant ID. So you can hear the audio down the telephone and still see the presentation on your device. So tonight, Nikki is going to be talking to us about pregnancy and maternity leave during COVID-19. So I shall hand over to Nikki for your presentation. Thanks, Nikki.
Thank you, Wendy. Good evening, everybody. And as Wendy has kindly introduced us, this evening we're talking about pregnancy and maternity leave during COVID-19. We've been extremely busy in the BMAS office, and I'm supported tonight by Peter Leatherby. And Peter will be helping to answer the questions later and make a note of some of the questions that perhaps we won't get to this evening, but we'll be able to answer on email or by phone over the next few days. So the questions that we've had over the last few weeks have been varied, and many of them. We've written some fact sheets, additional fact sheets about pregnancy and maternity leave during COVID-19. We've had people call us who've literally just found out they're pregnant, and people who are returning from maternity leave and due back any day now. So obviously, pregnancy is a very personal thing. There are personal circumstances that you're undergoing. You've got your own medical issues perhaps going on, or you might be sailing through your pregnancy and you're not worried about a thing. And all of the above we can help you with from an employment point of view. So let's start with who has the duty of care. So employers have a duty of care for the health and welfare of all employees, but they have a higher duty of care towards a pregnant employee. So that's worth noting, and we're going to come on to that a little bit later about what your employer should be doing. But also, it's not just about what the employer should be doing, it's about what you should be pushing for. There is an increased risk of severe illness from coronavirus if you're pregnant, and since the 16th of March, you've been placed in the vulnerable group. The vulnerable group are advised to observe social distancing. But if you think you have symptoms of coronavirus, you need to ring NHS 111 if you're in England, or NHS 24 if you're in Scotland. It's really important that you keep your midwife or your GP posted about any specific issues that you're facing or any illness that you have. And we're reading a lot in the press at the moment about people not necessarily taking medical advice about the general health conditions or other health conditions, and that COVID-19 has literally taken over the NHS time. But rest assured, if you are pregnant or you're planning a pregnancy, you will be supported by the appropriate people in the NHS. So the Royal College of Obstetricians and Gynecologists, that's quite a mouthful, have provided a lot of advice, and they have an excellent website, and that is on the last of these slides. And they're updating it, just like the BVA and the RCVS are updating all of their information, and we at BMAS are updating our information. The Royal College of Obstetricians and Gynecologists have an excellent website, and I've been referring to that over the last few weeks, and they're dating their updates. It's a great go-to place, and it has lots and lots of resources. So their advice is there is no evidence that pregnant women are more at risk of severe complications than any other healthy individual. So that's the critical thing. If you're healthy in every other regard, you're no more at risk. But if you think you've got symptoms, you need to let people know straight away. If you feel that you have any concerns at all, the initial thing to do is to self-isolate and tell your midwife and make the medical appointment. So what effect would coronavirus have on your baby if you were diagnosed with coronavirus? So there's lots of emerging evidence, and there's a UCOS survey, which is the largest survey of pregnant women who've been admitted to hospital with coronavirus. And they believe that 427 people have been admitted, and that's 4.9% per 1,000 of maternity admissions. And apart from those people with underlying health issues, they have the vast majority of those have not developed really serious coronavirus symptoms. So there is emerging evidence that suggests transmission from a woman to the unborn baby is probable, but it is really important to emphasize that in all reported cases of newborn babies developing coronavirus very soon after birth, the baby was well. So the UK Obstetric Surveillance System and Imperial College are running programs to continue to monitor pregnancy and neonatal outcomes, so you should rest assured there is constant updating of all of this information. So the government guidance for pregnant women and their households, no surprise here, regularly wash your hands, use tissues when you or your family cough or sneeze, and discard those tissues and wash your hands again. Avoid people with symptoms that include high temperature and a continuous cough. Try and avoid non-essential use of public transport. And where possible, work from home or adopt social distancing at work, and contact your GP. So one of the things that you need to do about work is ensure that a risk assessment is carried out. So the first thing you need to do is carry out a risk assessment with a senior appointed person and make sure that the risk assessment is written down. Now, we can help you to develop a risk assessment, but that would be very general. It's really important, if you go to the Health and Safety Executive website, they have many good samples of a spreadsheet type form which you would use of the risk assessment for your particular workplace and your particular role. So really, one size does not fit all. The risk assessment process, working conditions, agents that you might be using, which could jeopardize the health and safety of the employee or the baby, should be assessed and that risk written down. You could modify the risk assessment into a traffic light system where green is there's no risk and red there's quite a lot of risk. So if there's no opportunity for you to social distance at work, I spoke to somebody the other week where they had 6 veterinary nurses who were all pregnant, and they were trying to social distance them, but there really weren't enough offices or telephone stations for them to work with the 2-metre distance. And so some of them were furloughed, some of them were just going on maternity leave, etc. So it is about the specific facility that you're working in, the type of work that you're doing, which will help assess the processes, the working conditions, and any agents or chemicals that you're using. That would include the use of X-ray, handling chemical agents, and lifting excessive weights. What anaesthetics you're doing, and again, the social distancing and what is able to be managed within the practice and what is not. If a significant risk is found during the risk assessment, an employer must do all that is reasonable to remove that risk or prevent exposure to it, and must give information to you, the employee, on the risk and what action has been taken. So they might provide some PPE. They might say that you don't have to engage in any of the client referrals that you are doing. It might be that you're putting out meds, if you can use those, if you can handle those particular medications. It might be that you're manning the telephone from a separate office, and that would be absolutely fine. In these unusual circumstances, social distancing, home working, furlough may help to alleviate any risks. But remember that furlough will end at some point, and over the next week or so, we are expecting new updated rules about furlough. You might remember that originally it was put in place for a few months. It's extended, but there are going to be different rules about furlough, and people might be able to work part-time under furlough going forward. If there is absolutely no suitable alternative work and the risks are deemed to be too high, the risks remain, the employer must suspend the pregnant employee on full pay for as long as necessary to avoid the risk. That does not mean that every pregnant employee can go into work tomorrow and say, I'm allowed to go home on full pay, because it is dependent on the risk factor. So as the whole coronavirus testing, tracing, tracking improves, so people will be able to minimize these risks. And I've recently been involved in looking at a testing facility near to where I'm based, and we had to have some people tested because they thought they'd been exposed to coronavirus from a workplace. They were registered for the test within a couple of hours. They'd had the test within 4 hours, and they had the test results back within 24 hours. So fantastic service. And it might be that your workplace can register for these tests. And as of yesterday, everybody over the age of 5 who has believes they've had exposure to coronavirus can go for one of these tests. So if you have any concerns, that's what you should be doing. You can either register yourself, or you can register through your workplace if your workplace has registered with the local testing centre. And it's very easy to do that, and it costs nothing. So it might be something that you could offer to the practice, that you're willing to register, take on a couple of people's emails, and those people are able to register anybody for testing. And my experience, as I say, so far has been fantastic. So that's about risk assessments at work. And just to recap on that, they are available on the HSE website under risk assessments. And it's a fantastic resource. It just needs to be modified for each of your workplaces. This suspension on medical grounds, if the risks are deemed to be too high, then the employee remains suspended on medical grounds until the 4th week before the expected week of confinement, and this triggers the maternity leave. So, as I said earlier, there will be many of you in different situations, different stages of your pregnancy. Some of you might even be coming back from maternity leave. But this specific thing is about suspension on medical grounds, and this applies outside of COVID-19. This is a protection for people who are pregnant in the workplace. Antenatal and postnatal employee appointments. It's really, really important that you have contact with your midwife and you notify the midwife if you have any symptoms of coronavirus. If that is the case, you will undoubtedly be asked to delay going to a centre for your appointment, but you'll likely have a telephone appointment. It's really vital that you attend your scans and your appointments, but be advised that currently people are being asked to go to the scans alone. So your partner or your friend might be asked to wait outside. I've not heard of anybody in the last 8 weeks who's been able to be accompanied for their scan. You can take a photo of the scan and then show it outside, or you can ask permission to video the process. Some facilities are allowing that and some are not. Maternity care is essential, so they'll be monitoring you for all sorts of things, and it's not just about COVID-19, so please don't miss your appointments. You need to provide your employer with the MAT-B1 form after your 20-week scan. And my experience has been that some people's MAT-B1 appointments have been a little bit delayed, and that does make it difficult for you and your employer working out the dates when you would likely start your maternity leave. So bear that in mind, and if you need the MAT-B1 form, just remind your midwife. We're all working in different circumstances. If you do have coronavirus, then your appointments can be delayed, and they can also be delayed if you're shielding someone else. And if it's necessary to shield somebody else, initially that would be for 7 or 14 days, depending on the circumstances. And again, we've got advice for how long you shield for, and you would get an NHS 111 letter that says this is the period that you probably need to shield for if you're shielding a vulnerable person. But if it's not a vulnerable person, if it's because somebody in your household has coronavirus, then they might be able to get one of the tests I was talking about earlier. It takes away your concern. But if not, then you will need to shield for 7 days from the point that they've had the coronavirus, or 14 days if you are the person with the symptom. And at your antenatal or postnatal appointments, PPE guidelines will be observed. So it's important that you provide your own face masks and perhaps gloves. Maternity leave and shared parental leave. So that's part of this discussion here today. There are no additional provisions under the Coronavirus Act for maternity leave and shared parental leave. So you need to follow the standard process of notifying your employer when you plan to start your maternity leave. So those who are eligible for maternity leave can take up to 52 weeks maternity leave. The first 26 weeks are known as ordinary maternity leave, and the last 26 weeks are known as additional maternity leave. And the earliest that leave can be taken is 11 weeks before the expected week of childbirth, unless the baby is born early or you take any sort of illness and you need to start earlier than you expected. Then if you go sick, then it's deemed that you've already started your maternity leave. If you're on ordinary maternity leave, that's the first 26 weeks, your employer can ask you to return, and they can give you 8 weeks notice to return to work. You and your partner may be able to get shared parental leave, and therefore shared parental pay. This is applicable if you're having a baby or adopting a child, and that's up to 50 weeks of leave and 37 weeks of pay between you. And you can choose to be off together, or you can stagger the leave and the pay. If there is a gap between ordinary maternity leave and the dates that you opted to take shared parental leave, it is possible that you could be furloughed for that time. So that's the only real change to ordinary additional maternity leave and parental leave, is that if there's a gap between the ordinary maternity leave and shared parental leave, you could be furloughed. One of the things I really need to stress here is it's not the employee's right to be furloughed, and the employee can't ask to be furloughed above anybody else. This is a decision for the employer around the skill set that they need for the business. And we need to remember that furloughing is an alternative to redundancy. We're trying to protect jobs for the future. So saying, well, I'm pregnant or I've had a new baby, I don't want to return to work, is not necessarily a valid reason to be asked to be furloughed over other employees. I think one of the really important things to talk about is mental well-being during the pandemic. This has been covered by lots of people, and it's Mental Health Awareness Week next week, so something that we should be conscious of. And then, understandably, a pandemic will inevitably result in an increased amount of anxiety in the general population, but likely to be even more so for pregnant women, as pregnancy represents an additional period of uncertainty. So specifically, I would suggest that these anxieties are likely to revolve around the virus, the impact of social isolation. You haven't got your friends and family around supporting you. I've heard a couple of people recently who were expecting their mum to be close to them when they had their baby, and they've either been in another country or haven't been able to travel or haven't been well or have needed to self-isolate. So that's had a big impact on how the lady having the baby is feeling and adding to the self-isolation feeling. There's obviously potential of reduced household finances, especially if you've already been furloughed and you've been on 80%. And major changes in antenatal appointments and other NHS care, including appointments changing from being face-to-face with your friendly midwife to telephone contact. So take time to consider these factors and how you can overcome your anxieties. It is, as I say, likely to exacerbate during this period of your pregnancy, and you'll be worried about which way to turn. There is a lot of support out there, so please avail yourselves of all of that support. The Royal College of Obstetricians and Gynecologists details are there on the screen, and again the Health and Safety Executive. Some additional information that's come out since we prepared these slides is that nurseries and early year providers are being asked to open from the 1st of June. Now, people have different views on whether they want to send their toddler off to nursery. And as I said, if the child's a little bit older and there's any risk that they have coronavirus at age 5 or above, they can have a test. But a lot of people have been anxious about returning to work. They might be pregnant with a second or third child, and they're worried about the toddler. Well, nurseries and early year providers are being asked to open from the 1st of June. So if you've made provision to go back to work, or you've got an older child, It is very important that you follow that up now and see if your provision is going to be available. Childminders can open as long as they can limit the number of children, and nannies are now able to go to work, so it's taking some pressure out of the system. So things are moving at quite a fast pace. The people working in the maternity departments are very, very well organised. People are getting dates for caesarean appointments, etc. And they're very, very clear on who and what can happen at the hospital when you have your baby, if you've elected to have your baby in a hospital. So they're planning ahead, they're trying to remove this feeling of anxiety from people. So it's important that you engage in that process and find out as much as you can. I cannot recommend highly enough the Royal College of Obstetricians and Gynecologists website, so please make a note of that. So quite a potted view of what's going to happen with maternity and leave during this time and pregnancy. It is so bespoke. It is so much about your health, your general well-being, your mental health, and it's also about the job that you do and the risk assessment in that job, and that's the best place that you can start. So good luck. Call us if you need any additional support, and I'll hand back to the panel for the questions and answers. Thank you, Wendy.
Thank you very much, Nikki. Another great presentation. We've got quite a few questions come in, and at this point I'm going to bring in Jo Oakton, current Junior Vice President of BVNA, and Jo is going to help me deal with all the questions. So over to you, Jo, please.
Thank you, Wendy. Hi, Nikki. Hi, Wendy. I've got a few questions that have come through on the webinar and some questions that have come through on Facebook as well. I've tried to group them so they're not answered individually necessarily, but hopefully they'll answer your question. So one of them that's come up a few times is, if you're asked to return to work and the practice is not complying to the social distancing regulations, can furlough be requested? If furlough cannot be requested or is denied, and there are not enough steps taken that they feel to manage social distancing, where do they stand?
Okay, so as I said earlier, it's not really for the employee to request furlough, so the employer is within their right to say no. If the individual feels that social distancing is not being adhered to, then categorically, I think I would ask for the risk assessment to be completed and in writing. Now, there is another piece of law that is not to do with maternity or pregnancy, but it's time off for dependents. And anybody in this country can have time off for dependency leave. That's usually short term. So it might even be that you get a call from the nursery to say your child's come out in chickenpox and can you come and pick them up please until the spots have gone. And people have the right to be able to leave their workplace and go and look after that dependent, but it's unpaid. So with your employer's agreement, you could say, I don't feel safe. The risk assessment says I'm not safe. If you won't furlough me, then I want to take some unpaid time off, even if it's not to look after anybody else, and say, you know, I would like a period of suspension. I could use some of my holiday. I could start my maternity leave earlier if you're within that 11 weeks. Or I could take some unpaid time off, but only with your employer's approval. So there are lots of options, but the signposting on this is quite complex because the options are varied, and it does depend how far into the pregnancy you are or how close you are to returning from maternity leave.
Sorry, Nikki, can I just step in as well, which is the fact that there's a common misconception as well that people are entitled to furlough, which isn't true. Furlough is supposed to be a last resort before redundancy. That's why it was actually brought up and made. So if your employer doesn't agree with that, then you need to go back and come to a mutual decision with them regarding the best way forward.
Thank you. That answers a couple of the other questions as well, I think, which were surrounding furlough and the options if furlough is refused, and the other options that people can take as well. So thank you for that. Following on from it, I have a couple of questions about risk assessments. So what if there is a discrepancy between the perceived risk factor with the person carrying out the risk factor and the colleague's situation being risk assessed? And what happens if you ask for a risk assessment and one is not done? Where do you stand?
I think if one wasn't done, then I would be advising the employee to write to the practice and say this is a health and safety risk. You can't in this country be dismissed because you're pregnant, and you can't be dismissed because you raise a health and safety query. So it's very important that you put your concerns in writing. Don't rely on a phone call, text, or a message passed by somebody else. Now, if you don't agree with the person who's doing the risk assessment alongside you, then I would ask for a third person to get involved in that risk assessment. So it might be the practice manager, it might be the head nurse, it might be the owner, it might be a clinical director. It can be anybody in a position of authority that's working through that risk assessment. It is sometimes necessary to ask third parties about specific equipment and look at the manufacturer's instructions. And if you were looking at new procedures, new drugs that you hadn't previously worked with, of course you get all of the spreadsheets, just like the COSH spreadsheets that you get for any cleaning agents, disinfectants that you might be using as well. So I would always ask for a third person to undertake the risk assessment as sort of an independent arbiter.
Thank you. So if the risk assessment is done and it's decided that the unpaid option is an option that they want to take, will it affect maternity pay once that person goes on maternity leave?
It could do, because the way that maternity leave or the maternity pay is calculated might include the period where they had no pay. And of course, the first 6 weeks, which are paid at 90%, if you've been there for X amount of weeks, that's calculated over the previous 6 weeks. So it would reduce the amount, potentially.
There's another question, but I think this is probably down to company choice. So I was initially placed on statutory sick pay for the first 2 weeks. Should I have been paid full pay until furloughed?
It depends why you were sick, to be honest.
Yeah. And every company has different policies on that one.
Yeah, so some companies have company sick pay, and that might be full pay for a limited period. Everybody that's paid their national insurance contributions for 26 weeks is eligible for statutory sick pay. And coronavirus sick pay was full pay it wasn't full pay, it was SSP without the 3 waiting days. And the employer can claim that back, but it's only if you had coronavirus and had a doctor's sick note. Yeah, and had a doctor's sick note.
Yeah.
Thank you.
So it does really depend on the individual situation.
I think it would be that there's not any more kind of specific questions, but I think it would be good just to clarify again about pregnancy in the vulnerable group and what furlough is for, if that's okay.
Yeah, that's absolutely fine. So the Chief Medical Officer has placed all pregnant women in the vulnerable group, and that says that they should be extra cautious and avoid non-essential contact as much as possible. And we've got a fact sheet on this, so anybody can call in tomorrow for the fact sheet. And those measures are: avoid contact with somebody who's displaying symptoms of COVID-19, avoid non-essential use of public transport where possible, work from home where possible, avoid large and small gatherings in public places, avoid gatherings with friends and family, keep in touch using remote technology, and use the phone or online services to keep in touch with your GP, your midwife, or other essential services. So those are the measures around the vulnerable group. So they're not in the extremely vulnerable group, they're in the second category, which is vulnerable. And furlough, and Peter's already said there is a misperception that people have a right to furlough. They don't. The government has put this in place to help stop people being made redundant. And lots of veterinary practices have had to reduce the numbers of people they can see through the doors. And certainly many procedures are not able to take place. So a lot of veterinary nurses have been furloughed. But if you're the person with the skill set that they need, they don't have to furlough you regardless if you are pregnant. And the rules for furloughing are the employer's rules, and it's based on their business need.
Thank you. Can an employer force people to start their maternity leave early?
Under certain circumstances, yes, they can. So if you decided that you wanted to work until 3 weeks before your baby was due, and then you go sick, then you can be asked to, well, you can't be asked, then it's deemed that your maternity leave has already started.
Thank you. And along with the unpaid affecting maternity pay, does the furlough pay, the 80% pay, potentially affect maternity pay as well?
Yes, it would.
Okay, thank you. I think that is everything from the questions, unless Wendy can see anything that I've missed.
No, I think that's it. We've had loads of questions coming in all around with similar topics. So thanks, Jo. You've done a great job of sort of collating them into some sort of order. So thank you very much for that. I did manage to stream live on Facebook, so we have had quite a few people joining us on the Facebook Live as well. So thank you very much, everybody. Some of the questions, if they are quite specific to your situation with your own employment contract and how that all works, then the members advice line is available free for all BVNA members. So do contact, there we go, for further information, email bvna@bvna.co.uk. When you contact the advice line, you will be asked for your membership number just to clarify and confirm your membership status. So it might be worth trying to grab that and have that to hand. Thank you so much, Peter, Nikki, and Jo, for your help this evening. The webinar next week is the second part of the infectious disinfectant protocol. I can't remember the name of the exact title of the webinar, but it's for part 2, being presented by Amanda Curtis for us. So I think, unless there's anything else coming in, Jo, can you see anything we've missed in that question box? I don't think so there. Jo's muted herself. Are you back, Jo? You were talking to yourself then, I think.
I was talking to myself. There's no new ones on there that we haven't covered.
That's awesome. Thank you very much. This webinar has been recorded, as all of our webinars are. So we will be posting the recording up available, and these webinars during the COVID situation are available to the whole profession free of charge. Our webinars are normally a member-only service. And when we leave the webinar, you will be asked for your feedback. So do please give us your feedback. We want to provide webinars that are useful for our members and the profession, so it's really important that we get your feedback. It will only take less than a minute just to fill in that survey as you leave a webinar. So thanks again, Nikki, for giving your time to the profession this evening to help us in these difficult situations as best as everybody can. Thank you, Joe, for your time, and thank you, Peter, for being in the background there. Have a good evening and speak soon. Bye for now.
Thank you. Bye-bye.